Welcome to the Opioid Overview and Naloxone Training, presented by the Georgia Department of Public Health. The objectives of this presentation include the following. What are opiates/opioids? The effects of opioids. Routes of exposure. Identifying and addressing an opioid overdose. And a naloxone use training. What are opioids? Opioids are derived from the opium poppy plant, which is known as an opioid. Opioids are made in a lab, also known as synthesized. Opioids can produce a variety of effects including pain relief. Some individuals can feel relaxed, happy, or high when taking opioids, which can be addictive. Opiates and opioids are both used medically in the past and present day. Examples of opiates include opium, morphine, heroin, and codeine. Opiates are naturally occurring substances. Pain relievers available legally by prescription such as oxycodone, known as OxyContin, and hydrocodone, known as Vicodin, are opioids. Other well-known opioids include fentanyl and carfentanil. Please note carfentanil is only approved for veterinarian use at this time. Opiates/opioids may be prescribed for pain relief, surgical use, and cough suppression. Throughout 2021, the DPH Drug Surveillance Unit has received reports, which are believed to be related to street drugs laced with fentanyl, including counterfeit pills, heroin, and cocaine. Fatal and non-fatal drug overdoses have been increasing nationally and in Georgia in recent years, driven by the COVID-19 pandemic. Fentanyl is a key contributor to opioid overdoses nationally and in Georgia. A majority of overdose deaths in Georgia involve polysubstance use, with polysubstance meaning an individual having more than one substance in their system. During 2021, 64% of drug overdoses in the United States involved a synthetic opioid, with fentanyl being involved in a majority of these cases. Fentanyl is 100 times more potent than morphine, is an extremely addictive substance, and is relatively cheap to manufacture. Symptoms of an opioid overdose. An opioid overdose can be identified by a combination of 3 signs and symptoms, referred to as the opioid overdose triad. The symptoms of the triad include pupils that remain small, even in bright light, unconsciousness, unable to respond to people, and respiratory depression, slow, shallow breathing. Typically, an opioid overdose is identified by visually assessing an individual exhibiting the following characteristics. Unresponsiveness. Awake, but unable to talk. Limp posture. Face is pale or clammy. Blue fingernails and lips. Lighter skin people will have a bluish-purple skin tone. Darker skin people will have a grayish or ashen skin tone. Breathing is slow, shallow, erratic, or it has stopped. Pulse is slow, erratic, or undetectable. And choking sounds, or a snore-like gurgling noise, known as the death rattle. Here is a visual representation of some of the signs and symptoms of an opioid overdose discussed in the previous slide. The routes of exposure for opioids are similar to other health issues. Inhalation, ingestion, and skin-to-skin contact. However, pure fentanyl is not absorbed through the skin, but can enter the bloodstream if a break in the skin is exposed. Skin-to-skin contact with pure fentanyl does not typically result in an overdose, but other fentanyl analogs may be able to be absorbed through the skin. More research is being done in that area, as street drugs change their chemical structure daily, making it difficult to learn the properties and characteristics of each fentanyl analog. For this reason, we urge everyone to handle unknown or suspicious substances with the utmost precautions. A medication is available to reverse an opioid overdose known as naloxone. Naloxone is available under brand name Narcan, among other names as well. The reversal effects begin within 2 to 3 minutes after administering naloxone, with the effect of opioids being blocked for 30 minutes to 90 minutes. Multiple doses of naloxone may be required, as the duration of action of some opioids is greater than that of naloxone. In addition, patients currently receiving opioid treatment may experience withdrawal symptoms when administered naloxone. The next slide will play a video created by the CDC explaining how to administer nasal naloxone.
911, what's your emergency?
Steps for administering naloxone. Step 1. Call 911 and explain someone is unresponsive and not breathing. Step 2. Stimulate the individual awake by yelling their name and administering a hard sternum rub to the chest plate. Step 3. Administer 1 dose of naloxone every 2 minutes. For nasal naloxone, insert the device into one nostril and push the plunger. The device must be fully inserted to work properly, and the medication will be absorbed through the sinuses. Usually, after administering naloxone, a person may become physically ill and/or vomit. In this instance, the individual is experiencing withdrawal symptoms, which can be unpleasant, but not life-threatening. The individual may also be agitated and upset due to the withdrawal symptoms. It is also important to note that the individual may slip back into an overdose. So it is important to have additional naloxone on hand in case you need to re-administer the medication. A standing order for naloxone was issued for all pharmacies in Georgia on December 14, 2016. This standing order may be used by eligible persons or entities as a prescription to obtain naloxone from a licensed pharmacy in the state of Georgia. Additional guidance regarding naloxone. Naloxone should be stored at room temperature, away from heat, moisture, and direct light. Keep medication from freezing. Do not prime or test the nasal spray, as a device contains a single dose of naloxone and cannot be reused. Additional doses of naloxone may need to be administered every 2 to 3 minutes until the individual responds or emergency medical assistance becomes available. Naloxone is indicated for individuals that have opiates or opioids in their system and will not work with other medications or drugs. Naloxone is a safe treatment and will not harm someone if they are not overdosing on an opiate or opioid. This concludes the opioid overview and naloxone training. We thank you for your time and your attention during this training video.